Hi, good morning, everybody. Just gonna give it a minute to let everybody connect and join. Right. So shall we start? Yeah. We've got good strength,
Yes,
so we can go ahead and begin. Good morning, everybody, and welcome to this session on social behavior change and community engagement on day 3 of the South Asia SBCC conversations. I'm your friendly moderator. I'm Mandira, Kalaan, and I'm some of you know me, some of you don't, but I'm a social SBCC consultant, and I'm also working with Purpose as a campaigns director. We have 2 presentations this morning. The first will be by Mr. Monjur Ahmed, Communication for Development Officer at UNICEF Bangladesh. And the second is by Madhu, Kalra, and Saleha, Zahid, from Save the Children Singapore and Pakistan, respectively. Before we begin, just a few very small housekeeping rules that we can all keep in mind. You'll notice that all your microphones and videos are muted. That's just for keeping it easy for our presenters. Please do share any questions you have in the chat, and we will take them after the presentation. Any technical issues or any questions, please drop a message to Sukraj directly, and she can help you with that. And in the meantime, we can start. I'm going to hand over to Mr. Monjur Ahmed first. Sukraj, over to you for the presentation.
Hello, this is Monjur Ahmed. I'm working as communicator.
I just want to check, is everybody able to hear the sound when we play it?
Yeah, it's audible.
Communication for Development Officer with UNICEF Bangladesh. My presentation focus is UNICEF Bangladesh collaboration with radio stations for engaging with communities in COVID-19 response. When COVID-19 pandemic started last year, UNICEF Bangladesh started promoting the key preventive messages such as mask use, physical distancing, and hand washing. As co-lead of risk communication and community engagement pillar in Bangladesh, UNICEF Bangladesh has been trying to intensify social and behavioral change communication intervention in collaboration with multi-sectoral partners. When we started working with radio stations, we have tried to follow the very standard campaign theme, very consistent emotional pitch for mass communities, and very common branding across all messages and materials developed and broadcasted by radio stations. And the key messages promoted through these radio programs are mandatory mask wearing, physical distancing, safe hygiene practices, and also social and individual accountability to report and to test potential infection of COVID-19. With UNICEF support, these radio stations are playing a very crucial role in enabling the communities so that they can assess the risk of any humanitarian situation. They are broadcasting interactive programs with service providers, local administrations, stakeholders, and communities. In northern Bangladesh, with UNICEF support, state-owned radio stations and community radio stations are carrying out wide-ranging programs, mostly in local context, to halt the spread of coronavirus. And they have been broadcasting interactive talk shows, jingles, public service announcement on stigma prevention, personal hygiene, nutrition, education, continuity, social distance, child protection issues, and COVID-19 prevention and treatment. These radio stations are supporting in many ways the children, women, and the most vulnerable families with awareness generation, information access, and particularly voicing their views. They have launched series of week call-in and documentary programs on health, nutrition, education, and child protection in COVID-19 context. They have successfully communicated to the public what is known about COVID-19, what is unknown, and what is being done, and what actions need to be taken. They have facilitated local elected leaders and government administration engagement with the audience. These programs have helped to engage children at home in activities that promote learning when schools were closed due to prolonged lockdown. In many ways, they are minimizing COVID-19 impact with a mechanism for receiving and responding to community feedback on COVID-19 response. Establishing community linkage in pandemic situation is another objective of this radio programming. In collaboration with better stations, radio stations, UNICEF supported Radio Listeners Club members who often visit villages in their own communities to demonstrate the physical distancing norms and proper mask wearing and personal hygiene. With capacity building support from UNICEF, Radio Listeners Club's members have equipped local communities with the access to information they need during the pandemic. Now, we will look into the comparative advantage of partnering with radio stations in COVID-19 response. What we have found that these radio programs have 360-degree multi-channels. They have audio version, they have social media version, and they have community linkage to reach wider community in restricted mobility during COVID-19. And also radio is very easily portable and accessible in cell phone platforms. Radio can bring together communities, service providers, leaders, stakeholders, and government representatives in same interactive platform. These are not only creating a sense of accountability, but also helping to increase the community trust in COVID response. These are the implementing partners in northern Bangladesh. UNICEF have partnered with 3 state-owned radio stations in Rangpur, Rajshahi, and Thakurgarh districts. These radio centers have multiple district coverage, and there are 5 community radio stations: Radio Padda, Radio Mahananda, Radio Chilmari, and Radio Sharabala, and Radio Mukti. With this radio programming, we have successfully engaged and ensured participation of children, parents, adolescents, teachers, physicians, public health experts, local administrative officials, indigenous groups, cultural groups, religious leaders, local leaders, NGO, private sector representatives, and journalists. Finally, what I would like to say that these radio programs have pursued a very people-centered and participatory process so that community feedback can be sought and accountability mechanism in collaboration with government partners can be established. What we have believed that people have fundamental rights. We need to recognize their right to the information in any pandemic situation. They have right to get the health service. They have right to get the well-being of service providers. And these mass media programs have successfully reached the communities, particularly the most vulnerable, and they have successfully ensured interaction with the service providers and government representatives with proper behavioral focused messaging. Thank you so much.
Thank you so much, Monjur. Did we have any questions? You can put them in the chat. We can stop for a bit to have any questions now before we go on to the next presentation. While everybody else, here we go. Monjur, there's a question from Madhu, Kalra. What were some of the challenges? Could you identify some of the challenges you faced?
One of the most challenges actually of this radio programming, especially for community radio, that we don't have direct partnership with community radio. So we had to go through local government institution and also Ministry of Information to reach there. This establishing formal partnership with was one of the challenges, I should say, because these are not government, these are non-government entity. That's why we have faced some challenges to start the programming. Thank you.
Thank you, Monjur. I actually, while we're waiting for others to think of questions, one question that I was wondering if you could talk a little bit more about what kind of content was most successful? Was it trusted experts? Was it local leaders? Who were the most successful kinds of people when it came to sharing information on COVID? Because I'm sure that's something that many of us have dealt with. And what kind of content worked? Was it more entertainment-based content? Was it public announcement type content? I was wondering if you could elaborate on that.
Thank you, Mandira. This is a very good question. In any pandemic situation, especially during this COVID-19, restricted mobility was one of the challenges, of course. But and also there was another issue, that's gaining the people's trust. So surprisingly, we have found that our government officials, multi-sectoral government officials, were very responsive when questions comes to communicating with the audience and community people, and they are very responsive, very communicative while sharing with government initiatives to tackle the COVID situation, what services, what actions they are taking to limit the halt of the COVID coronavirus. We thought that this is also opportunity. This was also opportunity for the governments to share their plans, to communicate and to communicate their initiatives with the community level. So they have taken it very positively, and their response was also very positive and very spontaneous, I should say. And because of this, their responsiveness, community people who do not usually don't get access to government due to bureaucratic structure, they have been able to communicate with the government with this through this radio programming in both mass media, in state-owned weather station, also community radio. This was one of the success. Hope I have replied your concern.
Thank you, Monjur. Were there any other questions? So what we can do is we can move on to the next presentation, and we can always come back towards the end after that for a further discussion. So we'll move on to the next presentation by Madhu, Kalra, and Saleha, Zahid.
The COVID-19 pandemic poses a significant risk to children's lives through disruption to primary health, education, and child protection services. Vaccine hesitancy affects millions of people across Asia, with the potential to undermine the efficacy of any COVID-19 vaccine rollout. This Is Our Shot campaign is part of Save the Children and Meta global health partnership and aimed at encouraging more and more adults to be vaccinated. A very warm welcome to all. I'm Madhu Kalra, Regional Head of Communications with Save the Children Asia. And today I'm here with my colleague from Pakistan, Saleha Zahid, to share more about the program. Vaccination hesitancy is a child rights issue. Hesitancy to accept or seek COVID-19 vaccines is a real problem across the world and is actually a dynamic, multifaceted, and context-specific issue. Without adequate coverage, the challenges of the pandemic continue, meaning children's lives continue to be disrupted. In this context, This Is Our Shot is our innovative project launched by Save the Children in partnership with Meta across 8 countries and more. The main objective is to address COVID-19 vaccine hesitancy and promote vaccine uptake. It includes a set of tools and strategies enabled by technology to ensure reach and behavioral intent is maximized and recorded for both digital and non-digital audiences. This campaign started with collecting evidence to understand vaccine hesitancy for key audiences and barriers to vaccine uptake. A literature review was conducted, and evidence was updated throughout the year using social listening and Facebook data for good surveys to make it more relevant to an ever-changing context in Asia. Through the Data for Good surveys, we found three common sentiments around vaccines, such as people's lack of knowledge of vaccine safety and efficacy, concerns around vaccine side effects, and lack of motivation to accept the vaccine when offered. This evidence informed vaccine communication messaging on social media and other pathways like radio, SMS, chatbot, and others. These were crafted in a way to ensure that the content and messages were easily adaptable and we were able to react to the ever-changing landscape of the vaccine hesitancy issue. Across South Asia, we identified communication channels, messaging, and influencers that were relevant to the country's vaccine audience and context. Across all these different pathways, behavioral insights and technical health messaging was developed via credible messengers. These insights were hardwired into all content to make the messaging persuasive. In these countries, the teams also partnered with the national governments to scale efforts at the community level as well. Social media led people to the country's vaccine registration pages, or a WhatsApp messenger or a messenger chatbot, IVR, radio, and community miking also supported this exercise. In fact, all of these led to a consolidated effort where even remote communities with translated messages in several local languages were part of the campaign. While developing this campaign, we tried to ensure children's voices and the child lens was kept front and center. The children's voices were gathered through digital hangouts, which are focus group discussions conducted online to understand how children are coping with 2 years of the pandemic. We also included key results from the Save the Children 2020 COVID-19 Global Survey, which had over 25,000 participants. These years have been especially hard for children, being cut off from their school, friends, and communities. This understanding led to the key approaches used for the social media messaging of This Is Our Shot. It included emotive, fact-based, and influencer-led routes. This Is Our Shot focused on shifting the audience from beyond the pandemic and rallying audiences around what this could mean for communities, families, and children. What you see here are examples of the social media content which was part of the adaptable hackable pack released in Asia. We produced a series of emotive share cards and fact-based animated videos, and messaging from trusted, credible messengers was used. Emotive share cards included children's voices, opinions from health experts and influencers, while fact-based animated videos were more attuned to address questions around vaccine safety and efficacy, common side effects, vaccines for pregnant and breastfeeding women, herd immunity, and combating fake news and misinformation. Each of these prototype assets, developed with a behavioral insight approach, included insights such as social norming to increase vaccination behavior and help address safety concerns. We also tested social norming with other behavioral concepts like reciprocity to understand which approaches worked better to influence those to register for the vaccine when it was offered to them. All content was standardized to lead to national vaccine registration websites with a clear call to action and a time prompt across the board. The campaign is still ongoing, however, some initial results are really encouraging. Across South Asia, we reached 130 million adults. 5 million of them showed a positive intention to vaccinate by clicking on the national registration websites. 58 million saw our videos and 11 million engaged in some form or the other with our campaign. For Pakistan, the results are equally encouraging. We reached 31 million adults in Pakistan through this campaign. 200,000 of them showed a positive intention to vaccinate, as reflected by link clicks. 3 million saw the videos of the Pakistan campaign, and 3.3 million engaged with the campaign. These are really great results. And to talk you through more details, I hand over to my colleague Saleha from Pakistan. Over to you, Saleha.
Now that Madhu has gone over the vision and strategies for the Activate campaign at a regional level, I will delve into how we implemented this campaign in Pakistan. The vaccine hesitancy profile and literature review was integral in terms of defining the geographical scope and target populations for our campaign. For instance, the research revealed that there was no notable difference in vaccine acceptance rates between rural residents at 64% and urban residents at 65% in Pakistan. We thus formulated a multi-pronged approach comprising of strategic pathways to cater to various geographical contexts. This included a digital Facebook SBCC campaign, a nationwide radio show series, as well as a targeted bulk voice messaging campaign to reach rural populations. The research was also instrumental in helping us define specific target audience groups. For instance, it highlighted that there was a higher degree of vaccine hesitancy prevalent amongst women as compared to men, and found that 60% believed that pregnant and breastfeeding women should not get vaccinated due to fear of side effects for the fetus or newborn baby. We thus defined mothers and pregnant and lactating women as one of our primary target audience groups for the campaign. Finally, the research also helped identify knowledge and attitude barriers for more effective and targeted messaging. For instance, in 23 districts of Sindh, it was found that 44% of people believed that vaccine contained haram ingredients, and 40% believed that the vaccine would lead to too many side effects. The campaign thus focused on addressing misconceptions, perceived risks, as well as the fear of side effects. Partnerships were at the core of our evidence-based approach to campaigning. They were instrumental in increasing the outreach of the campaign, ensuring the use of the most effective tools and strategies to reach different population groups, as well as in terms of the development of persuasive messaging to change knowledge, attitudes, and behaviors. Government engagement helped us in identifying districts with the lowest vaccine registrations to effectively target vaccine-hesitant population segments. Collaborating with the National Expanded Program on Immunization for our radio programming also helped increase the outreach and legitimacy of our campaign. Private partnerships were also quite beneficial. Telecom companies have extensive experience with regards to mass campaigning. To target far-flung rural districts with high vaccine hesitancy, Zong recommended that we use bulk voice messaging and interactive voice recordings rather than SMS to enable the use of local languages and overcome literacy barriers. Our public health partnership with Facebook also played a key role in strengthening the efficacy of our campaign and messaging. Staff engaged in a 6-week training on SBCC, which helped in thorough audience profiling and setting behavior and communication goals and indicators for the campaign. Workshops and regional webinars also created essential open platforms for dialogue with other organizations and individuals to share successes, lessons, and feedback, which helped inform our campaign. Finally, we also engaged with schools to incorporate the voices of opinions of children and the youth in our campaign. Digital hangouts served to establish feedback loops where children could share ideas on content and messaging and ultimately become vaccine champions in their own families and communities. To conclude, I'll briefly run through how we used Save the Children's regional approaches and methodologies to inform our campaigning efforts. All the strands of our campaign were tied to the call to action to drive people to vaccinate themselves, so that they could reconnect with loved ones, children could get back to school, and life could go back to normal. The radio show series comprised of interactive nationwide talk shows addressing misconceptions and gaps in knowledge, with specific episodes catering to the concerns of women as well as the impact of the pandemic on children. The guest speakers comprised of trusted influencers, including notable health experts, government officials, teachers, mental health experts, gynecologists, as well as religious leaders. For the BVM campaign, we've developed a series of scripts that are being translated into local languages, including Urdu, Pashto, Balochi, and Sindhi. The scripts tackle various vaccine hesitancy issues by featuring conversations between children, a husband and wife, as well as religious leaders. Finally, we recently concluded our SBCC campaign. It was informed by A/B tests conducted by the region, and messages were targeted specifically to women. In accordance with regional guidelines, we used child voices and trusted messengers in the campaign and conducted a joint brand lift study with Facebook, which is still being evaluated. What you see here are samples of our top performing ads. Notice how we localized and adapted regional content with culturally appropriate images and emotive messaging to cater to the specific concerns of our target audience. We look forward to continue building on the momentum of the Activate pilot project, which demonstrates the power and potential of partnerships and collaborative efforts in effective social behavior change communication. We look forward to showcasing its results and learnings so that the program can be replicated in other regions across the world to combat hesitancy against the COVID-19 vaccine. Thank you so much for listening.
Thank you, Madhu, and it's extremely interesting to hear about vaccine hesitancy from a child rights perspective.
Mandira, we're facing a couple of issues with your sound. Maybe can you check your internet connection quickly?
Can you hear me?
Yeah, now we can hear you. Yeah.
Bhavani has a question. Chat, share it, please.
Yeah, I think Mandira is requesting Mr. Bhavani to please go ahead and share his question on chat.
Well, yeah, there's Bhavani Shankar had a question, had said, I have a question, but I'm just, if they could put it in the
Yeah, I'll just, Madhu and Saleha, I'll just read out the question for you both. I think Mandira had dropped off due to some network issues. So Mr. Bhavani's question is, how did you arrive at the messages and what behavioral theories did you take recourse to?
Thank you so much. Let me take some part of it, and I'm sure Saleha has insights to share from the Pakistan point of view. So from the regional point of view, there was a tremendous amount of work that was done to look at behavioral insights around vaccine hesitancy. Like I mentioned in the presentation, there was a survey in 2020 that was done on the COVID-19 survey that had 25,000 respondents, which formed the basis of the start of this. And on top of this, using the WHO message guidance and the UNICEF message guidance and a team of behavioral scientists who we work with within Save the Children, there was a set of opportunities that was identified as potential ways or levers that could be used in order to influence the behavior related to vaccine hesitancy. These were social norming, reciprocity, and a whole host of others. I'm happy to share more information there. These were then tested across the routes that we shared in the presentation. And after that A/B testing, we then finally used that learning where we found that the fact-based messaging and the trusted messenger influencer-led messaging seemed to lead to the maximum conversions and leading people to click most with a positive intention to vaccinate. Using these learnings, we then advised the country teams to adapt their content packs and attribute the final results to the Facebook Data for Good information, which is basically a survey that's done on a daily basis amongst Facebook audiences. So these were the key areas we used to develop our behavioral led messaging. Saleha, would you like to add anything more to this?
Madhu, I think you covered everything, but I think an integral part, apart from basing our messaging on, WHO guidelines, as well as, behavioral science, a key component of this was actually testing out the messages with different target audiences through, for example, our Facebook A/B testing, which allowed us to select which ones of our messages or which ads or videos were performing the best. And then we continued to strengthen our campaign based on those feedback loops that we created.
Thank you, Saleha and Madhu. Any more questions? We do have, and any questions for also Monjur, if there are some questions for the first presentation as well, we can take those now. Anybody? No questions at the moment. We do have a few minutes, so.
Mandira, this is Taul. I'm from the UNICEF Cox's Bazar field office. So I just, wanted to know, learn from you, and the Madhu and the Saleha can also say that, especially in South Asia, even in Bangladesh, India and Pakistan also, there are some pockets of vulnerable people, so and out of reach. So what would be the what was your strategy to reach the out of reach people? And obviously in some area there are some media dark area, so we could not reach them even by the social media, traditional media, television, radio. So what's the actually strategy to reach the out of reach people, and the what the intervention should be in the media dark area? Thank you.
Thank you, Atal Bhai. And this is a very great question, actually. In my presentation, I have mentioned that one of the comparative advantages of radio stations in Bangladesh and also community radio stations are that they have 360-degree platforms. Better that they have hundreds of radio listeners clubs who are working, who are very active at the community level. What we have done in mass media programs, we have addressed these issues, how to reach the community, how to reach area people with RCC messaging, because this was one of the challenges with traditional media. And with UNICEF support, what we have done in UNICEF support, we have provided capacity building training to these radio listeners clubs, and they have reached to the community level living in the hard to reach areas, and they are very active at the community level, and they have reached the community level with RCC messaging. This was one of the advantages we have seen in this partnership with radio stations. And also I have seen that I have mentioned in my presentation that they have also social media platforms. Through the social media platform, we have seen that they are reaching beyond their coverage areas also. This was another advantage of community radio and radio stations platforms. Hope I have replied to your question, Atul Bhai.
Yeah, I think so. Thank you, Monjur.
Thank you, Monjur. Saleha or Madhu, did you want to speak to Atul's question at all?
Yeah, so from our point of view, I know Saleha can speak at length on the radio activities that Pakistan did, but on a regional level, IVR is an opportunity which are pre-recorded messages. They also reach the Android population. In order to handle the digital divide, our logic was to first do a digital and social media campaign, because those numbers are massive, they go into millions. But also there are other millions that we hope to reach through either radio, community events, which my slide did mention it was there. And Save the Children has, as you know, along with other members like UNICEF, etc., also a huge community-based program. And this campaign was launched via the community-based programming as well, especially in Bangladesh and Nepal, where they covered, several, I think around 345 communities with community miking and similar campaigning offline opportunities. The other thing I'd just like to say is that a lot of this is, of course, inbuilt in the assumption that people have access to vaccines. And there is the assumption is that the people who have access to vaccines, even though they have access to vaccines, show vaccine hesitancy. So this campaign was meant to address that. Vaccine access is handled by Save the Children advocacy and our work with governments, national governments, which is singularly based on equalizing the vaccine inequity and trying to work with them in order to do better on that. I just hand over to Saleha to talk a bit more about the Pakistan activities. A lot of this was also very relevant there.
Sure, thank you, Madhu. So in Pakistan, to reach populations that didn't, for example, have access to the internet, apart from conducting nationwide radio show series, our collaboration with telecom companies was really important in this regard. And I spoke about this a little bit in the presentation as well, but we decided to go for voice recorded messages because most people do have access to cell phones, even if they don't have access to the internet. And to overcome literacy barriers in rural areas, we translated these messages into different local provincial languages. And we broadcasted these to the districts with the highest vaccine hesitancy. So in these different ways, through a multi-pronged approach, we tried to reach populations that had different levels and different access to connectivity. So hopefully that helps answer your question.
Yeah, thank you, Madhu. Thank you, Saleha and the Monjur. Monjur, actually, I'm a little bit curious to ask another question. I don't know whether this will be in the right forum. Just, you see that, even in the media area and hard to reach area, we are doing our, some intervention, how we can, reach them. And if you take a closer look in the vaccine hesitancy, you will see that in the upper class also, middle income class people also, they have some vaccine hesitancy for different reasons. So even you can say that something that I will not take the Pfizer, I will not take the Moderna, I will not take the Sinopharma. So there's some notion around the people still prevailing. This is my personal observation. I don't know whether any organization or platform or any country officer they have already done some sort of research over that. So still those who are educated people, literated people, and economically empowered, even still there's some hesitancy is prevailing on them. So whether do you have any intervention activities to address, to approach this segment of population, those who have this kind of hesitancy?
Thank you, Atul. Saleha, Madhu, Monjur, we actually have only about 2 minutes so that everybody can also shift to all the interesting sessions that are also happening further. If you want to respond very, very quickly, otherwise, I know that this is a massive conversation and can be
Yeah,
carried on.
Yeah.
Yeah. So if either of you want to maybe make a last comment, that would be great, and then we can wrap up.
Yes.
To respond to Atal Bhai's question, we have found that utilizing the social catalysts like religious leaders or social elites have been found very effective when they have interacted the community people with convincing messages that these vaccines are very effective. We have found that community is accepting this very very well. So this social catalyst engagement is very important to remove this hesitancy, and we have found this. We have observed this through our radio programs also. When they are interacting with the community, people are accepting it quite well. Thank you.
Thank you. Thank you, Monjur. Madhu or Saleha, a last comment quickly?
Yes, it's a huge problem. We call it the movable middle, which is basically people who are very pro, they are in the bag. People who are very anti, take a lot of effort to shift. Anti-vaxxers, and the amount of push they have on social is into billions. So you choose which part of the movable middle you want to put your efforts in. We chose certain audience segments in understanding where the vaccine hesitancy was most in the audiences we could reach in our partnership with Facebook through the health partnership. That data was invaluable for us to make decisions like this. So not a clear answer. Yes, it's there. But I think the idea is to take a step approach in order to address it over a period of time.
Thank you so much, Madhu. We have a number of other sessions that are starting shortly, and Sukraj has very kindly put all the links in the chat. Please do head over to the sessions 6 to 9, which begin at 11:55, and do join back at the plenary link. This is the last day, and there's lots of interesting conversations around COVID happening. So hope to see you in those sessions.